Good day. I am a physician, and today we will discuss a silent threat to your skeletal health. Yet most people remain completely unaware their bones could be quietly deteriorating right now without any symptoms. Therefore, understanding the DEXA scan is absolutely essential for protecting your long-term skeletal health and mobility. Consequently, this important medical information could prevent a life-altering fracture before it ever occurs in your body. 1 in 3 women over the age of 60 will fracture a bone due to undetected bone loss. Yet most of them had no warning, no pain, and no obvious signs whatsoever before the fracture occurred. However, a simple, painless scan can reveal exactly what is happening inside your skeleton today.
This video is for educational purposes only and does not replace professional medical advice from your doctor. Osteoporosis is called the silent disease for one very specific and important clinical reason that matters. It causes no pain until a fracture actually occurs, and by then significant damage is already done. However, the DEXA scan, or dual energy X-ray absorptiometry, is the gold standard for measuring bone density. Consequently, it is fast, non-invasive, and uses extremely low levels of radiation to save your life.
Number 10. Why bone density matters more than you think for your long-term health and mobility.
Your skeleton is a living organ that constantly remodels itself throughout your entire lifetime without pause. Yet after age 30, bone resorption typically begins to outpace new bone formation gradually and silently. Consequently, you lose approximately 1% of your bone mass every single year thereafter without knowing. However, this rate can accelerate dramatically during menopause due to declining estrogen levels significantly and rapidly. Therefore, low bone density directly increases your risk of fragility, fractures from minimal trauma, or falls. A hip fracture in older adults carries a 20% mortality rate within the first year after injury. Yet many people never consider their bone health until after a devastating fracture occurs unexpectedly. Consequently, preventive screening with a DEXA scan is your best defense against this silent epidemic.
Number 9. The difference between osteopenia and osteoporosis and why both require your attention immediately.
Osteopenia is the medical term for bone density that is lower than normal but not yet osteoporotic. Yet it is not a disease itself but rather a warning zone signaling accelerated bone loss is occurring. Therefore, many patients mistakenly believe osteopenia is harmless and requires no intervention whatsoever from doctors. However, untreated osteopenia frequently progresses to full osteoporosis within 5 to 10 years without treatment. Osteoporosis is defined as significantly compromised bone density that dramatically elevates your fracture risk substantially. Consequently, the treatment threshold and urgency differ substantially between these two distinct clinical conditions that exist. Yet both conditions demand a proactive approach involving nutrition, exercise, and possibly medication therapy for patients. Therefore, knowing which category your DEXA results place you in guides your entire treatment strategy.
Number 8. Risk factors you can control versus those you cannot for optimal bone health management.
Some risk factors for osteoporosis are completely beyond your control, such as age and genetics. Yet your family history of hip fracture is one of the strongest independent predictors of personal risk. However, many critical risk factors are entirely modifiable through lifestyle changes and medical management strategies. Low calcium intake, vitamin D deficiency, and sedentary behavior all directly accelerate bone density loss. Smoking tobacco and consuming more than 2 alcoholic drinks daily are also significant modifiable risks. Therefore, you have substantial power to slow bone loss even if you have unchangeable risk factors. Consequently, a DEXA scan provides the baseline data needed to target your modifiable risks effectively. Yet ignoring these controllable factors while focusing only on genetics is a dangerous medical mistake.
Number 7. Who should get a DEXA scan and when to begin screening for optimal bone protection?
Official guidelines recommend all women begin DEXA screening at age 65 without any exceptions whatsoever. Men should begin screening at age 70 or earlier if specific risk factors are clearly present. However, earlier screening is strongly warranted in several important and commonly overlooked clinical situations that arise. If you have used corticosteroids like prednisone for more than 3 months, you need a scan. Rheumatoid arthritis, inflammatory bowel disease, and celiac disease all dramatically accelerate bone density loss over time. A family history of hip fracture is one of the strongest independent predictors of personal fracture risk. Early menopause before age 45 significantly reduces the protective effect of estrogen on bone tissue. Low body weight, smoking history, and excessive alcohol use also qualify you for earlier screening immediately.
Number 6. How the DEXA scan actually works and why you can trust its results completely.
The DEXA machine passes two distinct low-energy X-ray beams through your body simultaneously during the scan. Different tissues absorb these beams at different rates, and bone absorbs far more than soft tissue does. The machine precisely calculates how much energy was absorbed at each specific anatomical measurement site. The most important sites are the lumbar spine and the hip, specifically the femoral neck region. These locations are chosen because they are the most common and most dangerous fracture sites clinically. The entire procedure typically takes 10 to 30 minutes, and you remain fully clothed throughout. There is no injection, no claustrophobic tunnel, and no significant preparation required beforehand at all. Consequently, it is genuinely one of the simplest and most informative diagnostic tests available in modern medicine.
Number 5. Understanding your T-score and what this single number means for your bone health.
The T-score is the primary number your doctor will focus on after your DEXA scan results arrive. It compares your bone density to the average peak bone density of a healthy young adult. A T-score of -1 or above is considered completely normal and healthy bone density. Between -1 and -2.5 indicates osteopenia, which is low bone density. This is a warning zone that signals your bones are losing density faster than they should be. A T-score of -2.5 or lower is the clinical diagnosis of full osteoporosis. This means fracture risk is significantly elevated and active treatment is almost always required immediately. Therefore, understanding exactly where your number falls gives you clear, actionable information to discuss with your physician.
Number 4. The Z-score, and why this second number on your report is frequently and dangerously ignored.
While the T-score compares you to young adults, the Z-score compares you to your age peers. A Z-score of -2 or lower is considered below the expected range for your specific age. This number is critically important because it suggests something beyond normal aging is destroying your bones. When the Z-score is abnormally low, your physician must investigate secondary causes of bone loss aggressively. Common secondary causes include vitamin D deficiency, hyperparathyroidism, and malabsorption conditions like untreated celiac disease. Certain medications, including anticonvulsants, proton pump inhibitors, and aromatase inhibitors, also cause significant bone loss. Without investigating the Z-score, you may treat the symptom while the underlying destructive cause continues unchecked. Therefore, always ask your doctor to explain both your T-score and your Z-score after every single DEXA scan.
Number 3. Bone density versus bone quality, and why the DEXA scan measures only one of these factors.
The DEXA scan is excellent at measuring the mineral density of your bone tissue accurately. However, bone strength depends on two equally important factors: density and internal structural quality together. Think of bone like a building where you need both strong materials and a sound architectural framework. Trabecular Bone Score, or TBS, is an advanced software analysis now available on many DEXA machines. It analyzes the texture and internal microarchitecture of the vertebral bone from your existing DEXA images. The lower trabecular bone score predicts fracture risk independently, even when the T-score appears relatively normal. Some patients with normal T-scores fracture because their bone microarchitecture has silently deteriorated over time. Therefore, ask your radiologist if TBS analysis is available and whether it should be added to your report.
Number 2. How often should you repeat the scan based on your individual baseline results and risk profile?
A single DEXA scan gives you a snapshot, but serial scans over time show whether bone is being lost. For patients with normal bone density, repeat scanning every 5 years is typically considered clinically sufficient. For those with osteopenia, rescanning every 1 to 3 years allows early detection of accelerating bone loss. If you are actively being treated for osteoporosis, your doctor will likely rescan you every 2 years. This allows direct measurement of whether the prescribed treatment is successfully rebuilding or stabilizing density. Medicare and most private insurance plans cover DEXA scanning every 2 years for qualifying patients completely. Do not simply assume your first scan was reassuring and never follow up because bone loss can accelerate dramatically. Therefore, tracking the rate of change over time is far more clinically valuable than any single isolated measurement alone.
Number 1. What to do after your results arrive to create a clear and effective action plan immediately.
Receiving your DEXA results is only the first step, and what happens next determines your long-term outcome. If your results are normal, focus aggressively on preservation through optimized nutrition and regular resistance exercise. Calcium and vitamin D sufficiency are non-negotiable foundational requirements for maintaining healthy bone density at any age. Weight-bearing exercise and resistance training actively stimulate bone-forming cells called osteoblasts to build new tissue. If results show osteopenia, your doctor may recommend lifestyle changes, supplementation, and a repeat scan in 2 years. For established osteoporosis, multiple effective pharmacological treatments exist, including bisphosphonates and newer biologic agents available. The FRX tool calculates your 10-year fracture probability and helps guide the decision to initiate medication treatment. Therefore, do not be passive because a DEXA scan is a gift of information that you must use decisively.
Your bones are living tissue that respond directly to the choices you make every single day. Therefore, the DEXA scan removes all guesswork and gives you precise, actionable data about your skeletal health. Subscribe, tap like, drop a comment below, and share this important medical video with someone you deeply love.